blood cancer does not begin as a tumor you can see. It begins deep inside the bone marrow in a place where blood is normally born. Inside the marrow, stem cells divide continuously. Some are meant to become red blood cells, carrying oxygen. Others become white blood cells, defending the body. Others form platelets, controlling bleeding. Blood cancer starts when one of these precursor cells acquires a genetic error, an error that does not kill the cell, but instead removes the controls that normally limit division. This single altered cell continues to divide, and unlike solid cancers, it does not stay in one place. In leukemia, the malignant cell remains immature. It looks like a precursor but behaves like a parasite. It multiplies rapidly inside the bone marrow, physically crowding out healthy blood production. As this happens, normal red blood cells decline, oxygen delivery falls, fatigue becomes constant, platelet production also declines, bleeding becomes easier, bruising appears without injury. At the same time, white blood cells increase in number, but these cells are dysfunctional. They look like defenders but cannot fight infection. As malignant cells accumulate, they escape the bone marrow and enter the bloodstream. This is a defining feature of blood cancer. The blood itself becomes the transport system. Cancer cells circulate freely, reaching organs that were never meant to filter malignant cells. The spleen is often affected first. The spleen normally removes old blood cells, but now it begins trapping malignant ones. It enlarges, pressure builds beneath the left ribcage. Blood filtration becomes distorted. The liver may become involved next. Cancer cells infiltrate hepatic sinusoids. Normal liver architecture is displaced. Detoxification and protein synthesis slowly decline. In advanced stages, malignant blood cells infiltrate lymph nodes. Nodes enlarge not because of infection but because they are being colonized. This is where leukemia and lymphoma begin to overlap biologically. In multiple myeloma, the process is different. Here, the malignant cell is a plasma cell, a mature antibody-producing cell. Instead of circulating widely at first, it expands inside the bone marrow. These cells secrete abnormal antibodies, which enter the bloodstream and thicken it. Bone tissue around the marrow is destroyed. Pain appears. Fractures occur with minimal force. Calcium is released into the blood, affecting kidneys, nerves, and consciousness. Kidneys are especially vulnerable. Abnormal antibodies clog renal filtration units. Inflammation follows. Renal failure may develop silently. Unlike solid tumors, blood cancer does not metastasize by invasion. There is no single mass breaking through tissue. Instead, the entire circulatory system becomes the disease pathway. Every organ that filters blood becomes a potential site of damage. Treatment targets the biology, not the location. Chemotherapy aims to stop cell division. Targeted therapy blocks specific molecular signals. Immunotherapy teaches the immune system to recognize malignant cells. Bone marrow transplantation replaces the entire blood-forming system, essentially rebooting blood production from scratch. Blood cancer is not one disease. It is a category of failures in the system that sustains life at every second. When blood formation goes wrong, no organ remains untouched.